Hello, everybody.
Hi, guys.
We were, we were just sitting around talking, and a couple of things came up, and we thought, hey, this could make an interesting little bit of content, a little like episode. I don't know if we're gonna make this a new series. Shane and Cari talk about something.
Shane and Cari chat.
You could do like Cari Sherry's.
Oh no, I don't like that. Cari's scaries.
There you go. But and then it would have to be a spooky. It'd have to be a spooky themed episode.
Well, it's spooky because it's so bleak.
Yeah, I suppose that's true. So why don't you set everybody up here? I mean, this was something that you had encountered in the wild, and then you brought to my attention, and we talked about it a bit. So.
Sure. It was a few years ago, and I think that I've shared the story, maybe not on the show, but on my Twitter, that must have been like 5 or 6 years ago. I was with my ex, and we went out to visit his mom for Mother's Day, and we went to Olive Garden, and we got there, and she had love Olive Garden. When you're there, you're family.
Big fans.
This podcast is officially sponsored by Olive Garden. So she had like a cooler, and the cooler had like a fish in it in a cup, and it was just kind of like sitting there. And eventually she kind of like, nobody really wanted to ask what was going on. Eventually she kind of told me this was like an early birthday gift for me. This little blue betta fish that really did not, it did not look very healthy. It was not in an environment that was, hospitable to him. And she told me, it's a gift for you. I was like, I don't really want a fish. And she was like, well, if you don't take him, I'll just flush him down the toilet. So of course I was kind of like obligated to take it.
So passive aggressive.
Yeah. So then I drove 2 hours with this fish in the cup in the car on the car ride home. I saved up. I got him like a little tank. I, really learned to love him. I taught him how to like eat little bits of food off of my finger. He'd like jump out of the water and got it. Yeah, I really loved him. I named him Arnold, and I really did like enjoy him as a pet. I guess like since I had rabbits for a long time and they're not really like the most interactive pet, I like knew how to make the best of it with a kind of shitty pet. No offense to people who raise fish. They're very beautiful animals, and obviously I loved my fish. So
it's lower maintenance in a certain way. It's less directly interactive.
And if you don't put like a lot of effort into it, you don't really get much out of it. Like I really spent a lot of time trying to like get him to eat the food off of my finger. It's not like a dog where they just like give you free affection, right? Mm-hmm. And, also it was a lot of like checking the water in the tank, checking the temperature in the tank, all that kind of stuff. I like really committed to it. So a couple years later, Arnold got sick. Like he just like looked kind of weird. And, I mostly just like went on Reddit. I tried to like ask people what was wrong. I posted pictures. I went on like fish forums. I tried a few things and he wasn't getting any better. And so the next thing that somebody suggested to me was to give him antibiotics. Maybe he had like an infection. Maybe the water in his tank was infected, even though it looked good and it was testing fine. So I started looking, and I think I first was looking on Chewy, but I also looked on Amazon. And as I was scrolling through, it became really clear that a lot of the 5-star reviews were not about fish at all. They were from people. People were using these antibiotics. And, for me, I was pretty lucky in that, like, I had insurance through my 20s because I had a job that provided it. And I had just never, the worst case scenario for me was just like racking up a few $1,000s in credit card debt from something that my insurance didn't cover. I had never been like, well, I'm not going to be able to get antibiotics. And it just had not occurred to me that like this is what people were doing. But apparently it was extremely common. And I came across these like dozens and then hundreds of reviews that were saying like, it's great if your fish develops a tooth infection and you don't have dental insurance for your fish.
Right, your fish in big quotation marks.
Yeah,
right?
Sometimes they say you're quote unquote fish. And this is something that the article that I ended up reading about this when we were just talking about it earlier referenced that a lot of the reviews are like tongue in cheek, right? They like kind of reference the fact of like, it's kind of ridiculous that I have to do this. Mm-hmm. I think that there might have started to be like kind of a crackdown on it. A lot of the reviews, because I had saved screenshots back then and I had like written a little thing about it to myself, kind of a like look at this later kind of thing. And again, this was probably like 4 years ago now, but a lot of them are gone. A lot of them are still there. And I think that this had originally started as like a prepper thing. Preppers like collecting fish amoxicillin for their like go bags or their prep kits or whatever, for when those institutions and like that infrastructure fails and you're not able to get to the doctor in some like apocalyptic situation. But the reality is that like that is happening now. Like there are thousands of people doing that right now. And I just thought that was like a really like poignant example of what's going on with our healthcare system. And it's like, it's like a stopgap that people are using. And then in a lot of cases, and this is what one of the articles that I read also kind of pointed out, it like acts as a critique of the system itself. Like the way that these people are saying it is like, it is insane that I have to do this. They tell us not to do this, even though like this like basically saved my life to be able to do this.
Yeah, the first time I had encountered that stuff and was through like looking at prepper stuff, and this was way before too that I even was trying to do that like academically or like particularly seriously. It was just when I was in my early 20s, and I've mentioned a couple times on the show just the kind of weird shit I would end up looking at. I would find these kinds of bizarre prepper websites and things that would sell a variety of different things, and then increasingly this kind of like self-care health stuff. I mean, the most notorious example of that, of course, was like Alex Jones and the InfoWars store with like the polonium silver shit and like
right.
the brain force pills, all this like kind of hack pseudoscience, sort of woo-woo, new agey stuff, but just repackaged as this like hyper masculine and hyper preparedness thing. And I'd seen a few places, and after we were talking about it, I looked into it again, and like there was like a lot of this stuff in like 2011, 2012, which was also like a sort of resurgence that the Obama administration was like a big resurgence of the prepper community, particularly online. I wonder why. I wonder why all those people suddenly felt so threatened, and that the government was going to collapse or whatever. But yeah, it was always like, it was always put forward again through this weird lens of like simultaneous like challenge to legitimacy of like the institution of like hey, the doctors say you shouldn't take this, but it's fine, whatever. But at the same time being like, this is smart, and this is like, this is even tactical, you want to fill your basement with fish antibiotics. And I found a couple, like on YouTube, you can find a couple of examples of them. There's like a few people, there was just like one guy I found who had a video about it from 2012 who is like, like a former military medic or something like that. A lot of guys who are in that milieu, play that up, and then they're like, here, and the fish antibiotics thing is just one of many different kind of like little life hacky things, because the idea, and particularly for the preppers, right, it's less about not having access to it, because presumably if you are a prepper, you're not every single person who has like prep shit, but a huge amount of them like have money, right? Like it costs a lot of money to store all that shit, and usually it's associated with people who like have houses and the space for keeping all that shit. So buying fish antibiotics is not really a way to get antibiotics when you can't have them. It's more of this like workaround for like how can I stockpile a bunch of them without a prescription, right? Which is again this sort of more like sovereign citizen-y, like I should have the right to like have my own pharmaceutical stash in my house. But it was really bleak when so like I had heard about it in that context, but when you told me about it, basically people now kind of using it as a means of like, because they can't afford to go to the doctor, to just get like a basic prescription for like amoxicillin or whatever, the most basic stuff. Right.
And, like you were saying, it is kind of like that impulse to stockpile or whatever that the preppers have. But there is that overlap there where like they're doing it with this idea of like, I need to stockpile this for when the systems fail. Sure. And the other people that are like, have a tooth infection now are aware that the systems are currently right now failing. Like the reason that I need to do this is because I cannot go to the doctor.
I mean, yeah, they're both reactions to the same kind of constellation of like institutional failure. It's just one is more of like a paranoid fantasy, and one is like dealing with the actual failure of the system, right? In terms of like not being able to afford stuff and not having access to it. I mean, there were plenty of times when you had mentioned in your 20s, you were had a job that had insurance. I had that for like some of my 20s, but for
Right.
most of my 20s, I either, had a job that I didn't have insurance through, or I was like unemployed or something, or, I was doing like part-time work or freelancing or whatever.
Right.
And so for so long, like I didn't have insurance, and it was and also being perpetually broke and living paycheck to paycheck, it was constantly like, is it even worth going to the clinic to and spending like $200
right.
to get the 7-day course of whatever antibiotic, or should I just kind of like wait this fever out?
Right.
And that's, a slightly lower stakes in some cases. Obviously in others it can be like legitimately life-threatening, but that's like a kind of bargain that we all have to make with the healthcare system, right? It's like, do I bother spending the money to go get the care I need, or just kind of wait and see if my body fixes itself?
And that's if you have the money, right?
Right.
For some people, it's just like not even an option. Like there was one story, I have like some short reviews that I collected, but there was one like slightly longer one in this academic paper that I found that is really illustrative of like the types of problems people are having, and like the way that it's just like a cascading set of like failures and pressures that they really have no other way to cope with. And I wanted to read that. I'll read the little intro to it, and then I'll read like the little story that the researcher put in.
What's the name of the article?
The name of the article is Stocking Up on Fish Mox. Mox is amoxicillin. A systematic analysis of cultural narratives about self-medicating in online forums. And this is by Rebecca Howes-Mischel. And it's really good. I definitely recommend reading it. Maybe we can include a link in the episode description. It's a little academic-y and like kind of dense to read, but it has a lot of like interesting examples of this phenomenon. You can kind of just like skim it and read through. And interestingly, you mentioned a lot of military guys on YouTube. One of the things that it touches on is that the U.S. Special Forces, even before this became like a trend with like preppers and like, people needing to do it out of desperation, they like were known to use fish antibiotics this way for some reason. And there is a link in the paper to a letter to the New England Journal of Medicine from the Pentagon about that, if you want to read that. It's linked. It's linked in the paper. So in the section titled Surviving Late Capitalism, it says, in survivalist forums, individuals present an argument that future hedging and cautions to only use fish mox when modern medical technology and resources are unavailable misses the fact that currently such technology and resources are already inaccessible for many communities, that the future moment that mainstream speculates about is the contemporary one for rural and impoverished communities. In this vein, fish mox as quote-unquote survival medicine has clear and present uses. And then this is the little story. My fish came down with a nasty case of bronchitis and sinusitis just before Christmas, but her health insurance doesn't kick in until the first of the year. So she couldn't go.
God.
Yeah. So she couldn't go to a fish doctor because she only makes minimum wage at the aquarium, and a trip to the fish emergency room would have put her in debt so far she wouldn't be able to get out. So she tapped on the edge of her tank with her sick little fin and blew bubbles in Morse code to ask me to order these for her. They worked great. She is now bronchitis and sinusitis free, and she only had to miss one day of work at the aquarium. She thanked me in bubble Morse code and said she would use them only when absolutely necessary in order to avoid creating super fish bugs. That's an Amazon review from December 2016, sorry. And that little bit at the end where he says, like, she's going to be super careful about it. That's something that's in a lot of the reviews. And there's almost like this guilt or this like feeling of like wanting to justify it. Because like the thing that doctors say to these people is like, never do this. You should never use fish antibiotics. Right.
When we first started like just Googling stuff to be like, oh, maybe we could talk about this, all the top articles are like, don't use fish antibiotics,
right.
They're bad for you and everything.
Right. And so people like try to kind of like legitimize maybe to themselves or to whoever is reading it their use of these antibiotics that they obviously need by saying like, we're being super careful with it. And yeah, I don't know. I thought that was really affecting. And a lot of them are like that. I have some that I saved here. Of course, there's like the more paranoid sounding ones, but there are some that are just like, my fish had a tooth abscess and didn't have dental insurance. These knocked it right out. My fish's tooth abscess is much better. He is smiling much happier now.
Oh, God.
Yeah. Then there's the ones that are like, stock up now, going, almost gone. You'll have to hit up your real physician to get this quote unquote prescribed for your fish in the future. And it'll cost a lot more for 100 pills too. Try about $1,000. That review is from Walmart. Yeah, I mean, there's just, example after example. You can look up any kind of fish antibiotic and see these for yourself. It's amoxicillin, ciprofloxacin, the same kind of common antibiotics that you might have had prescribed to yourself if you've ever had some kind of infection.
Yeah, I mean, what really I think is one of the things that really affected me in looking at some of those reviews and hearing you read some of them out is like, because it's in like second person and it's like talking about the fish as like a, like my fish, right? It's like, I'm always like, oh man, are they talking about themselves or are they talking about like their kids?
Right.
Like, because both are plausible, right?
Yeah, I mean, I definitely saw some, when I first came across this, that were just like very clearly about like children. Like it was just incredibly clear that they were talking about their kids. And then there were a couple of other examples that I went back and looked for, and they're all like a couple of years old, but they were from Reddit posts. And some people are like just directly talking about themselves, probably because, it's slightly more anonymized than trying to like, review something on Amazon that's tied to your account and your address and stuff. There was one person who said, they were like kind of arguing with somebody who said not to use these. And she said, yes, you can, like you can use these. I went to the doctor and she said, why are you not taking one of your meds? I told her the insurance did not cover it and it did cost a lot. She goes to her computer and pulls up several different pet sites, found the medication for a fraction of the price. So I asked her about the antibiotics and she said they are the same. She said many pet meds are the same as humans. She actually gets a human med for her dog because it is cheaper than the pet version. So there are some doctors that are just like, yeah, go ahead and do it. Sure. But most of what you find is like those articles you were referencing that we found. There were 2 articles that I found from like the Smithsonian magazine that were just like very alarmist, like, never take fish antibiotics. One of them had a story about like one woman overdosing on antibiotics. I guess she took a much higher dose than she was supposed to. And it's this doctor describing like, oh, and then she ended up in the ER with like a much higher medical bill. So like, you better just like go to the regular doctor or you'll be sorry. As if like that's an option. You know what I mean?
Right. I think that's the weird thing about it, right? Because it's like the messaging around it in the, like you were saying, the kind of alarmist stuff, like assumes that people who are doing this are doing it for some weird ulterior motive. When at least what you can see through the reviews that, what those demonstrate is that people are doing it because they can't afford the other shit, right?
Yeah.
And they're in some kind of precarious thing. And that's like, I think, to me, again, not only what is so like bleak about it, but so like emblematic of how like fucked up in general like the healthcare system is, in that like, there are these times, and I think if you've ever had, no insurance or have been underinsured or just like generally economically precarious, which I assume most of us have all experienced some version of that, right? Like you end up having, again, you have to do those little like moves in your head. You have to evaluate it and you have to think about like, how am I going to get the best deal? And that is at its core, like sort of capitalist logic and like the commodification of health, where we even have to perceive it as like, how am I going to get a deal? Like how am I going to like hedge all my bets? And, and because I guess, again, taking the alarmist perspective that the Smithsonian articles do, or any other like health institution ones where they're like, no, like don't do this. Like the worst case scenario you could really imagine is that somebody who doesn't necessarily, and this is like a fantastical scenario that I imagine is almost nobody or like a very small amount of people, but like you could conceive of like somebody being like, hey, like I have the money to go to the doctor to get the real antibiotics, but I can get the fish ones cheaper, right? Like
that's not,
no, but I'm saying, but even that scenario that they're painting out as like the potential, like, again, the alarmist one or the problem, like, don't do that, like, don't try to cut corners. Right. It's like that, the reason why people would even think to do that or be in that mindset is because we're so conditioned by the total precarity of the healthcare system in particular, but just like in general, like fucking life under capitalism, that we don't even know, like what the fuck else are we supposed to do? What else is somebody supposed to do if they're sick and they need help?
And that idea of like the way that doctors frame it is referenced a lot in like forum posts and reviews about this. Like people question, like, why are doctors saying this? And
Sure,
that was
right.
kind of what the academic paper that I read was talking about, how like the health messaging around this needs to change. It needs to not just be, hey, you're not supposed to do this and it's really bad that you're doing this. It needs to be like, I actually understand the underlying causes that are leading to you having to do this, and let's figure out together like what we need to do to fix this, and also showing an interest in fixing those root causes, like the fucked up healthcare system, you know, lack of availability of doctors in certain areas, underserved communities, things of that nature. And it is referenced a lot how like the only difference between these fish antibiotics and the antibiotics you would get if you went to the doctor and spent hundreds of dollars, the only difference is the label, that it says not intended for human use. And there's almost in that distinction and in pointing that out, there's like the question of like, why is that label there? Which is, it is a valid question. Like, why am I able to just like go and buy fish antibiotics for like $20, but I would need to like, you know, be able to like spend $300 to go to like an urgent care clinic if like my face is swelling up from a tooth abscess? Like, why? Why is it like that?
Right. I mean, I think that's, you know, the area of this that I'm slightly more familiar with, but I'm not, by no means am I an expert in, but like tangentially, just because of the field of stuff that I research, right? Like I've looked at and I've read a bunch of stuff in like health communications as a sort of subdivisions, both of like sort of public health messaging or whatever, but also as like communications as like an academic discipline at least. And there are a lot of like studies and papers and avenues of research that are about like what are the best ways to communicate about something, and there are often like, you know, good research finds problems with how things are communicated, right? How is information actually getting to people about what they need to do? And I mean, if you need a perfect fucking example of that, like look at the COVID pandemic, right? Like, and look at how, you know, on an institutional level, and we've talked about this a lot on the show, right? Like I've definitely thought it like a million times. I don't know how many times at this point I've said it on the show, but it's like
telepathically.
Yeah. But like, it's not a coincidence. If you're listening to this right now, we share a link. But you know, like I consider myself like a reasonably smart person. I'm plugged in. I'm like, I want to know about a lot of this stuff, sometimes almost to an unhealthy degree. And a lot of times, like, I can't figure out what the fuck like the state wants from me. Like, what does the state want me to do?
Right.
Particularly in regards to the messaging around the pandemic. And where I was going with that is just to say that, like, you know, a lot of that is like really good research, and it's stuff that like deals with like what are better ways to create, you know, avenues of communication between institutions and like healthcare professionals and the general public, as well as like, you know, individual patients and stuff about like what it is they need and how to like improve. And that will obviously, having better communication about that will improve care, it'll improve self-care, preventative care, all that stuff. But like fundamentally, you know, that's sort of, even if you fixed a lot of that stuff, it is a band-aid on what is a much larger problem, which is like the reason a lot of the communication is fucked up is because the system itself is fucked up. And there's no like easy way to communicate how you're supposed to get basic care when the way that you get basic care is like impossibly convoluted.
Right. I mean, yeah, like one of the main things that's brought up again and again when you're reading like academic papers about this is like nothing about the use of fish antibiotics is like challenging like medical expertise, right? It's just creating an alternative kind of narrative around it that focuses on this institutional distrust. And when the health messaging doesn't address that distrust, which exists for totally valid reasons, then it just completely misses the mark. If somebody is like having to use fish antibiotics because they make a minimum wage and they don't have health insurance, there's no way that just simply being like you're doing the wrong thing is ever going to get through to them. If anything, that's going to make them feel like more alienated. Right.
I mean, the thing is, right, again, there are these like actual problems in messaging, and you can take it where it's like, on the one hand, you have the institutional problems with messaging, right? Like unclear policies, unclear rubrics, unclear strategies of like explaining those to the public and to individuals, right? Like, you know, there's that. And then on the other hand, in that confusion, right, you have the possibility of, you know, people who have ulterior motives or who are just genuinely confused themselves and take it upon themselves to be like, well, I have to figure this out now. Right. And that does create an entire different like discursive way to engage with health communication, where it becomes like, well, I don't trust the fucking doctors,
right?
So I'm going to build this community online. And those are places where, like, obviously there are some like informal networks of health communication stuff online that are really beneficial to people, but there are other ones that are filled with, like, you know, really bad stuff, like stuff that has like bizarre political motivations, like the kind of preppery idea, like everything's going to collapse, so you need to like stockpile this, or like, you know, bad information, as we saw with the case of like the pandemic, you know, like the idea that you can take the hydroxychloroquine or whatever, and that'll fix it, because there is no like trust in those actual institutions. And then part of it again is like, well, you can address the problem of trust from like, you know, make them better at communicating and but ultimately you have to make them more trustworthy, like deep down. And the way that the healthcare system is set up, again, according to this like weird market capitalist logic, it can't be sound. It can't be cohesive and approachable and understandable.
I was wondering, when you were talking about that, there's one person referenced in this article that was referenced as Dr. Bone, which I think is a typo, because I looked him up by his name, which is Joseph Alton. His name is Joe Alton, aka Dr. Bones, the disaster doctor. And, you know, that just made me think, like, not to make any assumptions about Dr. Bones, the disaster doctor, but, you know, like, if you go to Dr. Bones' website and he tells you like how to use amoxicillin to like cure your kid's toothache or whatever, like that, of course that's going to make you more open to whatever other stuff Dr. Bones, the disaster doctor, has on his website. Like, that's just naturally what's going to happen. Like, you're probably going to end up trusting him more than the doctors who were telling you not to use fish amoxicillin to help your kid, right?
It's funny you mention him too, because I didn't read that same article that you did.
Yeah.
And I had that queued up.
You independently came across it.
Yeah, doomandbloom.net, where not only are there like articles about how you can use it, but there's a store attached to it. Like, you know, a lot of these places where you can actually buy the fish stuff, and as well as a variety of other like health products that are all kind of designed around being these like prepper things. I mean, but you can buy it from their site, and you know, they have like a book here, the Survival Medicine Handbook. Like, they have a whole YouTube channel, you know, podcasts. Like, it's a whole like, you know, online operation. And again, that's what I'm talking about in terms of like, you know, when you're kind of cut off and like left adrift to your own devices for something, you know, and this is not like a luxury product. This is not just like people independently finding this stuff. And maybe, you know, there are some people who go the route where it's like, I'm looking for healthcare that satisfies my political beliefs or something first before they encounter these problems. But most likely there's some tangled relationship where like people will just encounter this shit on their own because they're looking for stuff. You know, they're looking for some alternative healthcare system, and you know, this is one articulation of it. Obviously, the other one is the more kind of new agey stuff, or things that are, you know, focused on you know, kind of like junk supplements or what have you. And it's funny because that's also been demonstrated a number of times that a lot of times the kind of preppery reactionary stuff, and then the more like liberal new agey kind of stuff, they often sell the same stuff. Like the actual products they sell, the specific supplements, or you know, whatever things they have on offer, but it's just branded slightly differently, right? It's branded to be then part of like a lifestyle thing. And it's like, why should healthcare be like a lifestyle? You know, like why it's like, I don't want it to be like, you know, which aesthetic am I choosing when I take care of my broken leg? I just want it to be fixed.
Yeah, and I mean, what you're talking about there just like made me think that's like the framing of like something that I use recently, because I don't have insurance now to like do a blood test or whatever. I get like emails from it that are like, hey girlfriend, like our company is like adapted to your lifestyle. Like, we understand what you want, all that stuff. And it's like, I don't want that. I just want to know what's in my blood. Like, just tell me that. Be a doctor.
Yeah, that's the new one to add in there is like the millennial kind of like techie app version of those like stopgap things, like those different services that you can use that are like, you know, like direct to your door to fit in with your jet setting lifestyle. Like, you can buy it right through the app, or like you can talk to a healthcare professional, like,
get therapy on your
social
phone.
Media. Yeah, exactly. Which again, you can say like, well, maybe that works better for certain people, or that gives certain people a kind of ease of access. But the point here is that, like, at least for me, is like the reason why the access is fucked up is like a major structural one, right? Like, again, these are all just kind of Band-Aid solutions. There's no reason why you couldn't have like more easily accessible, either one-to-one communications with doctors or access to like medicine or medical information, without it being through some like weird premium subscription service. Right. That's also, like, hey, we're cool, we're hip with it, haha, we get you. I don't want you to get me. I want to have like a functionally, emotionally alienating experience when I go to like a hospital or whatever, and I want to like have a clinical interaction, and maybe like, I don't know. I've never had it, so it's hard to imagine. But like, maybe I could conceive of having some kind of social relationship or social friendliness within that relationship directly, like with a doctor or something. Somebody who knows you that you. But like, I've never had like a GP, so I can't even conceive of that.
I've gotten really lucky, and I had one really, really good like primary care doctor who just like genuinely seemed to like care about me and like me and remembered me. But that's like, one out of like dozens of doctors that I've been to in my life. I think that trying to, package that experience of personalized care for your lifestyle or whatever into an app is so insane, because the reality is that even when you like do go to doctors and you're like one-on-one with people, you never get that experience. So how are you going to get it through an app? Like, it just is never going to happen.
Right. I mean, and it's similar to a lot of other kind of tech solution-y stuff, not to go too off into this tangent, but like a lot of things that are offered to you as like, here, look, again, it's like through your phone, so it's like techie. What that actually means, most likely, is that the labor that goes into it, in this case, like the healthcare labor, right? Like, the person on the other end of the phone is probably like way fucking overworked, because they, instead of having like, a set amount of people that they're interacting with, or like a schedule or whatever, they have like 50 like open-ended text conversations going at once. At least, certainly, I mean, you've described it, and I know a few other people that we've talked to have talked about like some of those mental health care apps, and it's like people are like unresponsive and stuff, and it's clear like they're not going to be able to like provide that level of in-depth care, which is already like hard to find as it is. Like, it's already like, when you're going in person, like that's already hard to establish a connection with somebody who like you feel like you can trust.
Right. And I mean, I tried both of like the major talk therapy apps, like through your phone or whatever, BetterHelp and Talkspace, and it was because like I could not find, even paying out of pocket, I could not find like a therapist in our area. Definitely there were none on the insurance that I had at the time, but it was just not possible. So I tried those, and my experience was like awful. Like, it was just nightmarishly bad. And then I looked it up, and there was like all these posts from people who are therapists talking about how awful it is to work for the apps. Like, they just assign you like hundreds of patients, and there's no way to actually keep up with like responding via text. It's like, oh, your therapist is always available for you 24 hours a day. Like, that is an insane expectation already on its own. Right. But that's what they're selling for like, $100 a month or whatever. But I guess that's a lot better than paying like $600 to maybe see a therapist in 3 months. And that's why I tried it. That's why a lot of people try it, right?
Which again is that deal mentality, right? You have to strike that deal in your head. You have to be like, well, how can I get the best bargain? Well, this might not be as good care, but this is what I can afford with what I have. And, having to make those kinds of decisions about things that are, often like life or death, or like extremely very serious, whether it's mental health or physical health or whatever, like even like preventative health, right? Like having the ability to like just check in. Like I think the last time I had to do like a checkup, the last time I did one was like when I was forced to. I think when I was going into undergrad, they make you go through like a physical when I was like 18. I haven't had a physical since then. I probably should get one. I mean, look at me.
You're fine. You're very
but what
healthy.
I'm saying, I'm so healthy. All
the slurps really keep you healthy. They like fortify your immune system.
If you could take a sample of my blood, scientists and doctors would agree, and unbelievably healthy.
Pure slurp.
they like poke me and I just like start oozing out. And it's
gelatinous.
Like slurp mixed with like Hot Pocket goo. And they have to plug it up with like a pizza roll or whatever. But again, the point here is that like, obviously there's that element of like responsibility or whatever, like, okay, I need to take care of that, or I should, or whatever. But a reason why I kind of tuned out of it is like I said, for a long time I didn't have healthcare, and even now that I have insurance, like, I've talked about it on the show when I had that thing in my ear, and they basically just told me to like get the fuck out, and then they sent me like a fucking $300 or $400 bill,
right?
And it was just like you didn't even want to talk to me about it, and the resolution that the doctor said is like, yeah, you're probably fine. And I was like, right, but if stuff like this happens, aren't you supposed to go to the doctor to see if there are underlying causes? Like maybe there's something else going on. Yeah. Maybe, there's an underlying condition or something to watch out for. Like, hey, I'm 30, I'm 31 now, right? Like, this is the time of my life where like, I gotta really proactively take care of myself, and I'm trying to do that. I'm coming here, I'm paying you to do that, and you're like, yeah, get out.
Yeah. And then you think if you were to like Google your problem and you came across like Dr. Bones's website and he had like a whole article explaining how you could like fix the problem you were having at that time,
sure,
then maybe you'd be more open to listening to him question the science behind why people are rejecting hydroxychloroquine, which is one of the articles on his site that I just found.
Exactly. It's when there's that lack of trust in the official institution, right?
Yeah.
That can easily be displaced somewhere else.
Absolutely.
Or it can result in a situation which was kind of closer to the situation I used to be in, again, in my 20s, where I was just like, well, I'm just fucked. It's just total resignation, just total, like, there's no point in me even looking this shit up or going to the doctor. I'll just, like, have to deal with stuff as it comes, which is, maybe you can do that when you're 16.
Right.
But, like, you can't do that. For and most people, are not going to be able to bounce back from an immediate problem. Most people, need to be able to get care.
I mean, and not to get too off track from the initial topic we were talking about, but what you were just saying of, like, what's the point? Like, that just reminded me of, like, a few months ago when I had, like, my knee dislocated, and we called the EMTs, and they did come, and they were like, can't touch you, can't take you to the hospital, it's overflowing with COVID patients. And it was just like, oh, there actually like is nobody, like there's no medical professional to help me with this.
Right.
On like a Friday night or whatever it was.
Not even a thing you could like throw money at, right? Which is again the whole alternative argument for the market-based healthcare system, which is like, yeah, it's really complicated and shitty and it literally costs you an arm and a leg, but you have a lot more options. It's like, no, you don't. Like you were saying, like, not only were there not like mental health care professionals in our area, in your network, there were just none.
Yeah.
That you could get.
None. Yeah. Yeah. I mean, I remember.
So where's the free market?
Yeah. When that happened with my knee, I remember like a couple of our friends were like, oh, go to like an orthopedic ER or like call an orthopedic ER. And there were like none that were open. Like there was just like nothing to do. I literally just like waited until my knee snapped back into place and took like various drugs that we had in the house.
Well, actually, one of the things we ended up doing, which is again the thing that ends up happening for a lot of people, I fucking started Googling how to pop a knee back in.
I like posted a picture of my knees on Twitter. I was like, can anybody like help with this? Look at my knee. It's all fucked up.
Which again is like building that informal network or being like, oh, I guess I'll just have to figure this out for myself on the fly.
Right. And it's not because of like an inherent distrust in medical institutions. Like when that happened, I have like a defect in my knee that I've had since I was a kid. I knew that if it didn't snap back into place, what I've had to do before is like get somebody who like knows bones to like snap it back in. Right. So I called
Dr. Bones.
It's Dr. Bones, baby. He shows up at your house. No, but like, I just, in my mind, even though like I have such little faith in so many institutions and I know how fucked up the healthcare system is, in my mind, it was like, well, I'm just going to do what I always had to do when I was a kid. I'll call the EMTs. They will snap it back into place. It didn't even like cross my mind. There wasn't even like an inherent distrust on my part that caused me to like seek out an alternative. I was seeking that help and it just wasn't available. And I think, this ties back to like the people with the fish antibiotics are not doing this as like a first resort. It's because they can't afford to go to the doctor. They don't have insurance. Going to like an urgent care clinic costs like $200-$300 that most people just don't have on hand. Like they
often
just don't.
Even when you have insurance, it can cost like like $100-$200 at least in New York, like the City MD ones, which are all fucking scams.
And I mean, sometimes you go and you spend $200 and they're like, nothing is wrong with you, and they just like are trying to like push you out because they process like 10 patients an hour with the same doctor or whatever.
I mean, one time I went and I had a cracked rib, and it had happened the night before, and then the next day I woke up and I was gonna try to still go to work because I couldn't miss work, and it was so fucking painful. I couldn't breathe, and I even got on the subway thinking like I gotta get to work. Maybe I can take the day off tomorrow. I can't miss work today. I need the money. And eventually I was like, I feel like I'm gonna die, and so I got off. I think I was on like 14th Street in Manhattan, and I went to like the nearest urgent care clinic, and I was working at the time, and I had insurance, and I was like, I'm having like a serious problem. I feel like I can't breathe. I could barely talk. I was like gasping and wheezing, and they said like I had to pay. I don't know. It was like $150 or $250 somewhere between there up front to see the doctor. And so I said, fine. So I paid it, went in, waited 5, 10, 15 minutes, again, feeling like I was going to die. Doctor came in, said like, okay, let me like touch your chest. He did. I was like, that's a 10, baby. That's a 100% pain. I feel like I'm going to die.
10 in a bad way.
And he said, yeah, you probably have a cracked rib. You're going to need to go to the ER. Yep. And I was like, okay, well, can I have my $200 back then?
Right. Yeah.
And he said, well, you could talk to billing, but no, unfortunately, you got to pay the blah, blah, blah. And I would have told him off if it didn't feel like I was going to die every time I opened my mouth.
And similarly, like if you were to like talk to a doctor or, even because there is a lot of pushback. I did see like a lot of posts when I was looking on like Reddit, like there is a lot of pushback against like taking the fish antibiotics, even like between regular people. But, like there are people who would tell you like you'd be stupid to not go to the doctor if you think you have a cracked rib, right? As if like that's like your best option. But then you do that and nothing really like comes of it. And that, that experience is like, I would say in the United States, it's probably like an almost universal one of like having to spend a bunch of money, to like go to the ER and get like some Tylenol, and then they charge you like $2,000 or whatever. Like they don't even help you, or they like miss your problem is also very common. And that builds that environment of like distrust that again just like opens it up for like Dr. Bones and everybody else to try to help you, and also maybe to do more than that, not always with the best intentions probably, or just to like sell you stuff.
Right. Yeah.
Obviously,
just to do like a grift. Yeah.
Right. And that's not to say it's not like genuinely good information that people like Dr. Bones and his ilk are providing. I'm sure a lot of it is very good information.
Let's not disparage the good Dr. Bones. Okay. That's a name you can trust.
That is Dr. Bones, the disaster doctor, is my personal primary care physician.
I'm Dr. Bones. Bag of bones.
Does he sound like that?
I have not watched his videos. But he doesn't look like that either. But in my head, a Dr. Bones is
like wacky.
Comes to mind. Yeah, more like an old prospector.
Sure,
like he's missing his teeth, some of his teeth,
sure.
And he's like, "Well, folks."
Yeah,
I'm coming through town. Get your bones ready.
I was thinking more of like the, Dr. Bones TV show, but your thing is cool too.
There's a Dr. Bones TV show?
Yeah, Bones. She like works at a museum examining bones. I forget what her name is. It's a good show. Everybody check it out.
Then there's the Star Trek Bones.
What's the Star Trek Bones?
The doctor in the original Star Trek.
Is the doctor in the original Star Trek named Bones?
Well, yeah, it's like his nickname.
Oh, I didn't remember that.
Yeah, I think because it's a...
Is he a bone doctor?
No. It's like a nickname. I think the idea is that like way back when, maybe in like the Civil War or something, Bones was like a nickname in general for... doctors, because a lot of what they would do is just like horrible immediate war surgery. Where they're just like, cut somebody's, they just amputate somebody's extremity that had gotten shot or whatever. And
it always comes back to this with you.
I'm so sorry. Okay, when you're looking up WebMD to start getting worried about potential problems based off of your foot hurts or whatever, I'm looking at like the Civil War and all the various different wars and saying who came up with what.
Yeah.
Super glue. All right, anyway, go. You go. Sawbones. That's what they used to call doctors. Old saw bones.
Old
yeah, because they would literally...
they saw the bone off.
They would have to saw through bones.
And now you can do that at home with the help of Dr. Bones.
Bone saw
I'm just kidding.
ready.
Don't do that. I mean, I think I also, like, something that I wanted to say was, like, you know, we're kind of complaining a lot about, like, the medical establishment and, like, the state of healthcare. That's not to, like, say it is ideal for you to take fish antibiotics or that it is, like, preferable or to disparage, like, the profession of doctors in general, but rather the context that they're kind of forced to operate in, where people don't really have access to the care that they need or the information that they need. And when they kind of try to find ways around that, usually what they're met with is like some kind of shaming or like, you know, just admonishment. And there was one more thing that I wanted to read from that journal article. In this part of the article, she's describing kind of like some of the different ways that people communicate in these reviews and like what that stuff is indicative of. So I'll read the little intro part again and then read the actual thing from the consumer. It says, finally, some people seek to explain the humiliation and injustice of having to rely on fish mocks through narratives that reflect an expectation that health is an individual responsibility rather than a public good. They illustrate the strong focus on personal responsibility that saturates the survivalist community and echo classically neoliberal constructions of health as a matter of individual and disciplined choices. As one writer concludes about her decision to finally resort to using fish mocks to treat increasingly debilitating tooth pain, quote, since it happened to me, I feel there is something unethical about me being forced into taking fish medicine because of my poor financial luck. I did something wrong in my life, apparently, to end up here. Business school or nursing school, anything that would have offered more security than my liberal arts education. I just dove into this path without thinking at all about healthcare and insurance coverage. This was young and silly of me. I forgot that I live in America where we have to look out for ourselves and only ourselves. That's why I'm taking fish meds. Because for every warning I read against taking the drugs, I wondered if the doctor or vet was being paid to say it might not be safe. Their arguments didn't stand up except with big scary adjectives used as props. That's from March 2015. You know, and she's kind of like voicing that in the context of like her own personal shame, but also kind of saying like this is like a structural failure, right? And I think that's the part of this that's like really interesting to me is like the broader context that this is happening in. I'm not promoting taking fish medicine. Taking fish medicine is probably not ideal, even though it is the same as the human medicine in a lot of ways. And we could get into like the way it's manufactured and how some of them are manufactured in the same places as like the human meds are manufactured. Other ones contain stuff to like make your fish's scales brighter, and you genuinely should not take those because they can be like poisonous to humans. But you know, that's not the most interesting part of it, right? It's like, why is this even happening at all?
Yeah, again, I mean, it's that's the result. Like that last review or whatever that you read again is heartbreaking, but also like I don't know, it's so clear in its rendition of like what the problem is, right? Like in the sense of like, you know, when you have these medical issues and they pile up as they are wont to do in a system like this, right? It ends up becoming like your problem. It's like you're faced and then you're often guilted, right? And made to feel ashamed based on like your choices, right? Like that's the way that like public health is like framed in this country. Even when it comes to like nutritional stuff, right? It's like, oh, the problem isn't that like fast food is the only food available in lots of places and it's been marketed to kids and blah, blah, blah. The problem is that like people make bad choices and eat the wrong way, right? And of course, there always is some amount of like individual responsibility that you can like point to, but the big headline is it's a huge structural failing, and when you focus in on that or allow the kind of entire system around you to make you feel that about yourself, right? It's like it's really a tragedy. It's a failing of the system, right?
Like, there shouldn't be a context in which your personal choices lead to you being unable to get basic medication that you need for an infection. Like there just shouldn't be,
right? Yeah. And again, I think, you know, the thing that also piques my interest about this in talking about like how it influences like the kind of construction of narratives and like how health communication in general works, right? And again, partially because of, you know, the pandemic and like seeing it play out and being like, what are we supposed to do? Are we wearing masks? Are we not wearing masks? Like, do we take the vaccine? Like, how many doses do you need? Like, are you going to need like a booster? Like, you know, where's the clarity on any of that information? You know, there was a few studies I know done like years ago that were aimed at this like problem of like I'm trying to think of the name of it, but the general idea is that particularly when it comes to like sort of nutritional stuff, right? Like, and the way that popular journalism covers information, like health information and public health information, right? Because that's where a lot of people are getting it. It's not necessarily just from your doctor. It's like from the news, right? Like and whatever that means to you, right? Whether that was traditional cable TV or even like fucking newspapers or magazines, or now it's like social media, right? Like, and for a while, right, like, also you can make the argument because news has an incentive to be sensationalist and to you know to publish stuff without really like thinking about it or like, you know, following up on it, because it also works in like a market logic, right? Like there's all this like contradictory information that comes out all the time on a baseline, and you know, you see headlines like, and I still see it even on Twitter, you know, where it's just like people that say like scientists say, which is like such a like a weird throwaway, like who, like what, like what scientists, right? Like, but it'll be like scientists say, you know, the classic example of this is sort of like coffee or like red wine, right? It's like scientists say coffee is good for you. Scientists say coffee is bad for you, right? Like a new study comes out that says blah, blah, blah. And without really, you know, especially in the popular press, without diving into like the methodology or again following up on it and being like, was the study replicated? Who also funded the study? And all of that kind of stuff. What ends up happening just on a consumer level is like you read this stuff and you're like, oh, coffee's good for me. And the next day you say, oh, coffee's bad for me? Like what? And it doesn't even necessarily mean it's contradictory. It could be like, you know, one thing says like, oh, it might lower your problems with this kind of problem, but it might increase your problems with this kind of problem. But the general takeaway that ends up happening, right, is that like when you're encountering this sort of seemingly contradictory or like really confusing information, my intuition about it is that what happens is that like it's not like you start believing one thing or the other thing. It's just you start tuning out. You just start saying like, well, they don't know.
Right.
If the scientists, in big quotes again, if like they can't decide whether coffee is good for me or bad for me, then I don't care anymore.
Yeah.
And that's a much deeper like communication or like social problem than even like necessarily believing an incorrect piece of information, which is also why, especially in the context of like health stuff, the misinformation framing is like, I think can be valuable, but I think it's been overstated because it's not so much even that it's like particular things that then people believe, although of course you can always point to examples of those that are really harmful, and I'm not saying that they're not, but it's the bigger social takeaway where it's just like, I don't believe any of this shit.
Right.
You know what? Fuck it. It's the same thing. This doesn't matter to me. I mean, people have the same reaction to politics too, where they're like, they're all full of shit. You know, all the doctors are full of shit. All the journalists are full of shit. All the politicians are full of shit.
All the podcasters.
All the podcasters, but not Dr. Bones.
No. The only one you can trust.
And ultimately, that what that results in is that feeling of like resignation or cynicism or whatever, and that too can be framed even internally like, oh, I've come to this conclusion on my own. You know, I'm a savvy person. I get it. And you know, it's all bullshit. But in reality, a lot of times that's like deliberately cultivated because what a lot of those institutions want when they're driven by market logic is they don't want to take care of you. They want to make money. The news doesn't want to inform you. It wants to make money, right? Like, and everything else is ancillary to that goal. And so if when you get resigned, right, in a certain way, that's the kind of end result they want. They don't want you to even go to the doctor.
Yeah. And that reminds me of like one of the articles that I was reading that was like very alarmist about like not taking fish medicine. The title of the article is like, this is why taking fish medicine is a truly terrible idea, or it's a truly bad idea. Sorry, I don't want to get the Smithsonian Magazine wrong.
Have them breathing down our necks.
It describes in detail what the process should look like to get antibiotics. And it's like when a doctor prescribes you antibiotics, the first step is blah, blah, blah. And it like describes this like whole ideal scenario, which like if you're reading this and you've literally like ever been to a doctor, that is not what it's like going to a doctor. You do not sit and have a conversation with your doctor and they explain to you like the risks of taking antibiotics. They might like offhand say like, well, we're not really supposed to prescribe antibiotics that much anymore, but I will do it this time or whatever. Like it just, that's just not the way that it goes. Like the last time that I got antibiotics, I went on a fucking app and I got on a video call with somebody in another state and he was like, I guess I'll give you Cipro. I hope you feel better. Go to the hospital if you don't. Yeah, and I was feeling like pretty bad, and that's how that went. So like if you're reading this as like a consumer, you come across this article because you're considering getting like fish amoxicillin because you have like a tooth abscess. You're going to read this and you're going to be like, this is like bullshit. Like, who's writing this? Who is this for? This is not even reality. So of course then it becomes a situation where you're not going to like trust this source, not necessarily because like they're like actively trying to misinform you or whatever, but just because it doesn't line up with reality. And that's kind of what the academic article that I was reading was like getting at, that, health communications that does not address those root causes. It just like pretends that we are in this like idealized world where you're going to like go to your doctor who remembers your name and like doesn't even need to look at your chart, and they're going to talk you through how antibiotics work and all this stuff. Like that shit is just not going to happen. And you have to like acknowledge that it's not going to happen to be able to get somewhere telling people like, here's how I'm going to make this better. And if you're not going to make it better, then they're not going to listen to you anyway. Like, what do I care if some doctor who's quoted in the Smithsonian magazine tells me not to take amoxicillin? Like, I need it.
It's just one bottle of antibiotics, Michael. How much could it cost? $10? Yeah. Yeah. I mean, again, it's the weird, it's turning it into a personal choice as opposed to like a structural failing that leads to a necessity where it's like, I need this thing. Right. How can I get it? Right. And sure, that you're painting an ideal world picture, and I guess we'd all like things to work that way. Sure. And, but that's not how it works right now. And in order to resolve it, like you say, you have to resolve that underlying problem, right? Which fundamentally, at least in terms of healthcare, right, is like, it's because it's driven by market logic. Absolutely. As so long as it is that, you're going to have problems like this. You're going to have things that then arise to meet the gap. In a weird way, like the arrival of fish antibiotics, right, is like a market maneuver. Sure, that is the quote-unquote like ideal market thing trying to correct itself. It's like, here's like this weird, shittier product that we can't really guarantee, but it's not controlled, so you can take it if you want to try it. And when you're desperate, what else are you going to do? Right, like Dr. Bones is making a profit off of this. You go to his site, he's got like a big banner ad. That's like the free market working. You click on the neon fish antibiotics banner ad and you get what you need, right? Like Dr. Bones is rolling in it. He's just rolling in bones. Bones and fish. The bones are his money. So are the fish. I'm sorry. No, it's perfect. That's a perfect end to this. You just ended on that. Yeah. I don't know. Yeah, that's it. I mean, yeah, I don't have. There's no like. There's no like great wrap up for this, right? It was just something I came across that was like really bleak, and then I read about it a little more, and it was even more bleak. And it's just another example of like a cascading set of structural failures that we're all just kind of trying to live with. And I do have like a particular interest in the stopgaps that we use to cope with a failing system. And I'm sure all of you have your own experiences with stuff that you've tried to use to deal with, inadequate services or lack of access to stuff or not being able to afford what you need. Yeah. I remember there was, I think when I had the, my really like traumatic like tooth surgery thing when my wisdom teeth were all fucked up. Yeah. I almost died. I had like an abscess and everything, and I went to like the surgeon, and and they gave me like a whatever 4 days worth of like some opioid, fucking hydrocodone or whatever. And then I was like, what do I do when this runs out? And they were like, oh, take ibuprofen. And I was like, well, taking a couple ibuprofen isn't going to help. And the guy was just like, yeah, take 10, take 12. Yeah. And I was like, doesn't that fuck up your stomach? And he was like, yeah. Yeah. That's like, oh, okay. Because you told me that. That's what I ended up having to do when I was like severely injured and my doctor wouldn't give me real pain medication. I like couldn't walk. I was just like, all right, I guess I'll take 8 ibuprofen at once. Hey, I'm still here. I'm not recommending. We are not medical professionals. Don't listen to me. My solo Dr. Shano's Brainos podcast will be coming out next month, and you can check out the store for that. I'll be selling all kinds of pills. Fish pills. Pills that make you a fish. Fish pills. Quote unquote. Yeah. It's just like DMT. Oh, he's not doing that. Don't call the police. Yeah, I mean that's it. That's what we've got. And to play us out, Dr. Bones and the Bones Symphony. I hope that the producer can find that. All right, love you. Bye. Bye.